All right, well, it is Breast Cancer Awareness Month in October, and we wanted to share the story of a local woman that really highlights the role that patients can play in their own awareness of their health and also advocating for their health. Dr. Frank McGeorge has the story.
I was doing my self-exam and found a lump, and which didn't feel right to me. It was different than what I had felt in the past.
Lori Nimmo brought the lump to the attention of her doctor.
I had a biopsy on August 4th, and by August 7th, I found out I had breast cancer.
It was her 24th wedding anniversary.
It's scary, very scary, because you just don't know. You hear so many horror stories of people not beating it, but I knew I would be okay. I knew I just had to follow the journey.
It's a difficult journey this family knows all too well. Lori's husband, Eric, beat bladder cancer 8 years ago. Then, 2 years ago, she lost her mom to bile duct cancer.
6 weeks and 5 days from diagnosis, we lost her. So that was tough. We brought my dad here to live with us from Ohio, and he was diagnosed with aggressive prostate cancer. So right in the middle of his treatments, I found out I had breast cancer.
Lori and her dad are now seeing the same oncologist. Lori had surgery in August and starts radiation treatments this month. Her first grandchild was born just days after her surgery.
I just wanted to tell my story because if it helps one person to go get a mammogram or to do a self-exam, I think that's important because I think as women we just don't take care of ourselves. We worry about our families and our jobs or whatever, and we don't take care of ourselves.
It's a message echoed by her surgeon, Dr. Stephanie Cole at DMC Huron Valley Sinai Hospital in Commerce Township.
In addition to getting your annual mammograms and screening breast exams, it's also important to know your own body and your own breast so that if you find a change or an abnormality or anything that concerns you in the meantime, that you don't wait just until the next year to make your appointment, that you go in and see your doctor right away. Doing those screening exams can help us find things early so that we can treat and cure it.
I've already had a couple people tell me they've already had their mammograms because of my story, so that's good, and I hope more do.
All right, and Dr. McGeorge joins me now. We think so many times you get screened and then you're done. Don't think about it then for another year. But really the story of still advocating and being aware is so important.
Yeah, that's exactly it. I mean, I think everybody, and women in particular, need to be aware of their own bodies. And anytime you notice a change, it's something that you should first take note of and then monitor. And if it seems to be something that's distinctly abnormal, you should talk to your doctor. And, in this patient's case, it was obvious that she had developed a lump and it didn't feel normal, and she did absolutely the right thing by following it up with her doctor for further testing. Not everybody would have done that, as you point out.
Yeah.
She might have thought, well, I just had a mammogram, it's nothing to worry about, but that's not really true.
I think also sometimes that we can be guilty of, we don't want to bother anyone, or I don't want to bother the doctor, I'm asking a dumb question, or maybe I'm being alarmist, but it's one of those things that if you have that gut feeling, it's okay to ask the question, and maybe it's fine, it's nothing.
Oh, and that's absolutely right. When she saw her doctor in follow-up of the lump, her doctor would examine her, and if the lump had certain characteristics that felt more benign or harmless, maybe the screening or the repeat testing would have been put off a little bit longer. But that's a professional opinion that should be left to a professional, and you shouldn't be afraid to bring it up with your doctor, and she did absolutely the right thing. It was actually fortunate that she had a pap smear scheduled to get follow-up so that she could ask about the breast lesion. But I think even if she didn't have the pap smear scheduled, the breast lesion by the lump, the new lump she found, would have been enough to bring her in, or should have been enough. And you point out an important thing, being afraid to bother the doctor, or maybe just even being afraid of the diagnosis. In fact, the doctor in the story,
That's true, yes.
She mentioned that she's seen patients that were afraid to go to their doctor because they were afraid of what they might find out. Well, in a way, I understand the feeling, but that's even more absurd. If you are afraid of what you might find out, that is all the more reason to find out.
Exactly, and it's like you don't worry until you actually know something or you have some answers.
Right.
I love when we do these stories, and any time that we're talking about cancer awareness, be it breast cancer, be it colon cancer, I know that even if it hits one person to say, gosh, I got to make my mammogram appointment, or I didn't even think about something in that way. This is what these campaigns really do when you hear people's stories.
Yeah, that's exactly it. I mean, these are teachable moments, but they're also moments to encourage individuals out there who may not have had their screening, who may have delayed it, who may have put it off because of COVID or family reasons or whatever, to go out and get it done. Because the fact is, you never know when cancer is going to hit, and there are a lot of people out there who probably delayed screenings during COVID, for example, who may have developed things that are completely treatable if only they were found. And so now we need to catch up and find them. And I realize it seems like COVID was forever ago, but it really wasn't that long ago. And there's still a lot of people out there who have not had appropriate screenings.
Yeah, we have these screening tools for a reason, and then they
Absolutely.
can make a difference. All right, Dr. Frank McGeorge, it's good to see you. I know
Sure.
we'll be having more stories later on
Yeah,
in the month.
of course.
Sounds good. All right, have a good one.
Take
We'll
care.
see you in a bit.